discoloration of the skin around the mouth and nose. If your skin has turned grayish-bluish in the area of the nasolabial triangle, that's basically your mouth and nose. This may indicate that you're not getting enough oxygen due to poor blood circulation. This oxygen deficiency can be caused by different illnesses like lung or heart disease. It can also be a sign of anemia, which is a drop in the number of red blood cells in your body. Fewer red blood cells means less oxygen being transported to your organs and tissues. If you've spotted this discoloration on your face and it just won't go away, you'd better get to the doctor sooner than later. 10. Extremely sensitive, glossy, or bulging eyes. If you've noticed these changes in your eyes, this may be one of the first signs of hyperthyroidism or thyrotoxicosis. A diseased thyroid gland produces an excessive amount of hormones. As a result, a person needs more oxygen, so their eyes naturally become bigger, giving them a sort of constantly scared look. Fat tissue in the eyes becomes swollen and squishes the optic nerve. That's why many thyroid patients often complain about blurred vision and bizarre color perception. Thyroid issues are no joke, so it goes without saying. If you've got any of these symptoms, get to the doctor ASAP. 9. Eyelashes that have become thicker and longer. Who wouldn't want to have long, thick, beautiful lashes to highlight their lovely eyes? Well, yeah, plenty of people. But if you feel that your eyelashes have started to grow abnormally fast, this could be a real problem. Experiencing curlier, thicker, longer, or more pigmented eyelashes is a condition called trichomegaly. Some people are born with it, but it can also be caused by serious ailments like tuberculosis or immunodeficiency disorders. It's also been cited as a side effect of certain medications. 8. A puffy face. A puffy face with swelling around the eyes, as well as dry skin and thin, fragile hair, are some of the first signs of iodine deficiency. Iodine is responsible for proper thyroid function. Again, I can't stress enough how serious an unwell thyroid can be. If your thyroid gland is diseased, it affects your whole entire body. Besides these symptoms on your face, if you notice that your weight is constantly fluctuating or you have an increased sensitivity to the cold, it's high time to see an endocrinologist. 7. Soft yellowish spots on the eyelids. People who have xanthelasma or yellowish cholesterol-filled sacs on the skin, mostly around the eyes, are at a higher risk of developing heart disease. As harmless as they may seem, these spots indicate that the body isn't metabolizing fats properly, which can result in a condition called atherosclerosis. In a 2011 study studying 13,000 participants, Danish researchers found that 70% of people who had these cholesterol-filled sacs on their eyelids had pretty high chances of developing hardened arteries in the future. They also found that 50% had an escalated risk of having a heart attack within the next several decades. If you notice xanthelasma on your eyes, visit a doctor and be sure to make good lifestyle choices for better heart health, like watching what you eat and getting plenty of exercise. 6. Eyelid swelling and peeling. According to statistics, 1 out of 3 people who's ever used cosmetic products on their eyes has experienced an allergic reaction to them at least once. Flaky or reddened eyelids may be your body's way of telling you that your eye makeup or moisturizer contains some components that your skin doesn't agree with. In most cases, allergic reactions are caused by preserving agents added to cosmetics to prolong their shelf life. To avoid such problems, opt for cosmetics with the shortest list of ingredients, and always do a test patch on the crease of your arm before putting anything on your eyes. 5. Itchy ears. If you suffer from constant itchiness in your ears, this may be a sign of eczema, psoriasis, or some sort of allergy. The appearance of eczema, irritation, or similar skin problems means that you could be dangerously low on vitamin D, also known as the sunshine vitamin. Therefore, doctors recommend getting at least 10 minutes of sun a day. If you live in a place that sees more cloudy days than sunny ones, that lack of sunlight can be replaced by supplements and vitamins. Itchy ears could also indicate a fungal infection. In any case, only a professional can determine the cause of these unpleasant symptoms and prescribe the correct treatment.